Okay, so hello everyone. Welcome to the July 2023 Coast to Coast Prostate Cancer Support Group meeting. My name is Maya, and I'm very glad that you could all join us here today. So the Coast to Coast Prostate Cancer Support Group is an initiative of Prostate Cancer Foundation BC and its national network of support groups, Prostate Cancer Support Canada. These meetings have a different speaker each month, and they speak on topics ranging from new treatments to side effect management. Prostate Cancer Foundation BC staff include myself, Maya Quaynor, who is the support services assistant. And usually you will see Rochelle Green here, the support services manager. And every once in a while, Leah Lariviere, our executive director, will join these meetings. About us, we are a grassroots nonprofit offering support to patients across Canada. We have many free resources, including a video library, support group meeting calendar, specialized support groups, and dedicated online forums, local support groups across the country, Reef Not Kit information packages, one-on-one peer support, and monthly newsletters. To take advantage of these resources, just visit our website, prostatecancerbc.ca. So I'll just go over the agenda for today. I'll go over a bit of housekeeping and overview of the participation and housekeeping and overview of participation guidelines. Then we'll move into our presentation from Dr. Singh. And then I will have a moderated Q&A with Dr. Singh, and then we will have our support group roundtable discussion at the end. So just to go over the guidelines, due to the number of people participating, we kindly ask attendees to use the raise your hand function, which is on the bottom toolbar, if they have a question. People clicking on the emoticon will show up on the top left area of the screen in order of when they raise their hands, and then I will call on them. Alternatively, you may type your questions or comments into the chat. We also ask that you keep your mics muted during the presentation and when you're not contributing to the Q&A or discussion. This is our privacy disclaimer. What happens in the group stays in the group. So by attending, you agree not to share other individuals' experiences outside of the group, not to out another patient if you were to happen to see them outside of this group setting, and not to record the meeting in any way. The support group cannot and does not offer medical advice regarding diagnoses, diagnostics, therapies, or drugs. Rather, we are encouraged to share about our lived experiences with treatments, side effects, coping, etc., and offer resources to each other. The information provided by the moderators or attendees in these meetings does not supersede the diagnosis or treatments prescribed by your medical oncologist. Please discuss any treatments or interventions with your medical professionals before trying them. To the best of our ability, the moderators or informed participants will attempt to correct any unintentional misinformation. So I will now introduce Dr. Shaminder Singh. Dr. Shaminder Singh is an assistant professor in the School of Nursing and Midwifery at Mount Royal University's Faculty of Health, Community and Education. He has a diverse educational background, including professional training in nursing, psychology, qualitative health, research, and yoga, and has worked in various countries before settling in Canada in 2009. Today, he will be speaking to us about the importance of prostate cancer patients engaging in research. He is currently leading a research project exploring how people cope with prostate cancer, navigate uncertainty, make treatment decisions, and manage the illness and its risks. So with that, I will now have Dr. Singh start the presentation.
Thank you. Thank you, Mayor, and thank you for inviting me for this important meeting. As you said, my name is Shaminder, and first of all, I want to make sure, is everyone able to hear me? Can you hear me?
Yes,
okay.
I can hear you. Is everyone else okay?
Don, can you hear me? Okay. So I'm assuming that everyone hears me. So my work, I'm a registered nurse, and doctor in front of my name is because of my PhD in nursing. And I did my PhD in nursing and postdoctorate in community health sciences in the Faculty of Medicine in University of Calgary. And then I joined working as an assistant professor in Mount Royal University. I'm teaching nursing students. So when I'm students, one of the things that I teach is, one of the courses that I teach is adult health. And in adult health, cancer care is part of it, very much in the center of it. And cancer is what we are learning from the literature. So my whole experience of a cancer is in the periphery of it. Many of you who experienced cancer, your experience is in the core of it. And you are more expert than me, because what I'm learning is from researchers and from research participants like you, who share information, but that is filtered through the writing process, to the analysis process, and then it comes to me. So, but when I talk to people who have prostate cancer or other cancers, we do research on cancers a lot in my team. We learn from them. Sometimes we learn from them so much new that is not available in the literature. So I'm speaking here, I'm not speaking to kind of a teaching or giving you information that you don't know. I'm taking this opportunity to share what I'm finding, what I'm doing, what I'm finding in my research, and also want to learn from you. You are the experts. That's why I'm saying that my talk, the title is Seeking from the Experts, and you are the experts. I my expertise is in qualitative research. There are two types of research. Many of you already know about it, but those who don't know, I just briefly explain it. That one is quantitative research and one is qualitative. These are the two basic domains of research, and there are different types of research in each of those domains. And my expertise is in qualitative research. Quantitative research is when you already know a hypothesis and you want to test that hypothesis, then it's best for that. But qualitative research is best for something that you don't know and you don't have a hypothesis in your mind, and you go into the field to learn from the experts who are the participants, people who experience, who have lived experience of whatever the phenomenon that we study. With my qualitative research experience, I happen to work with one of the researcher whose whole focus is, her name is Dr. Lin Yang. She works with me in University of Calgary, my colleague there, and we came to realize that when she does work with the prostate cancer patients, she's doing some kind of a intervention like Tai Chi and physical activity intervention to help people with prostate cancer manage it the way. So when I was working with her in that project as a co-worker, it was not my main project. We realized that with the prostate cancer, it is true with every cancer, more so with prostate cancer, that there is a lot of uncertainties that people experience when they get their diagnosis, before their diagnosis, even the PSA is going a little bit higher, and then that uncertainty goes. And people who are expert, I have seen in my research, people who are doctors, nurses, healthcare professionals, and when they go through that kind of experience, even those experts in their work, they feel powerless and they feel that things are not in their control, and that uncertainty they feel, it's overwhelming sometimes. And kind of a support we have in different regions of our healthcare system in BC, Alberta, are not same. And you may find things that are better at one place, and you may find things that are at another place. Plus, our universal health system, which has so many good things about it, but sometimes it's challenging to maneuver that healthcare system and learning the priorities, because healthcare system might have their own priority, but the patient has their own priority, and matching those priorities, it's very difficult. So that's what we noticed while doing research with the prostate cancer patients, developing an intervention to help them manage their prostate cancer diagnosis, and after that the treatment.
So we'll start with what I was saying, and that how we got into this research. And one of the observations that we made when doing prostate cancer rehabilitation research, which is helping the prostate cancer patients to get ready for, in terms of physical activity, for the treatment, and after that to manage it, we noticed that there are lots of uncertainties. And decision-making process, which is we have lots of support in our healthcare system as compared to so many different places, but we still we don't have the full range of services that are required for prostate cancer patients to make the decision. For example, if we don't know how to assess the level of understanding, because prostate cancer can hit anyone with any different kinds of language capacity, with different kind of intellectual capacity or background, health background or knowledge background. So we kind of have a, like right now, the services we have, they are kind of not tailored for each individual. They are tailored for the population. And we have all those services available, such as providing information to the new prostate cancer patient, and we don't differentiate if the person already has some background information or not. Doctors and nurses, they try to do it a little bit tailored information from their own perspectives, but we could have a better system. And in order to understand that better system, how we can develop that better system, we need to know what are the uncertainties that people have. Different people have different kind of abilities and different kind of strengths and different kinds of challenges to process that information. And that depends. In my research, what I'm finding, I've done like about 12 interviews so far, and those interviews are geared totally to understand the experiences of people who have prostate cancer. How did they get the diagnosis of that? How did they break that information to their family members? How did they process themselves that information? What are the questions they asked the healthcare professionals? Are they satisfied with the information they received, or what was the process for them? Some people say they were so overwhelmed in first session that they barely remember a few things out of it. And what are the online and offline resources they could find? When we are learning all of this, we are finding lots of gaps, and those gaps are that those services are not tailored. So what are then we are learning through our interviews, what are the factors, individual factors, that might influence people's processing that information, the information they receive from the prostate cancer centers or from other professionals. And those factors are level of education, level of people who know English or not, and they already had some kind of experience with the surgery or some healthcare system. Some people remain so healthy in their life, they never been hospitalized. Their experience is different than people who already had some kind of a surgery, so they are a little bit more, they can anticipate their needs before and after the surgery. People have different people are on their different stage of their life. For example, one of my participant lived alone, and they didn't know that little small things like such as emptying the catheter, Foley catheter, would be a problem for them, because they would not be able to move after the surgery, and they would not have any help, so they couldn't arrange the help they could if they would know all of this before. So people who are living with the family, not living with the family, their own physical abilities, some people are a little bit older than the other, and some people are not, the physical strength is not the same for everyone. So how they maneuver it, and the psychological, which includes how they process the information, how they take that information. What are some people are more anxiety prone, and some people are less anxiety prone, so they would behave differently with this information that they are receiving. So we are learning tons from those experiences, and what we are trying to find out that what is the way how we could use all of this information and make this services tailored. So that's the question we are juggling with every day in our research, that what are the information that we are, how we tabulate all those information in one system. So and then how can we train healthcare professionals to provide tailored information? So what they have to do eventually, they will have to assess each individual with their capacities, abilities, and the resources that they have, and then find out the challenges, predict the challenges that one particular individual would have, and based on that provide the services. And it's a very much needed, but it's very difficult to do that in a large scale. So one of the things that seems promising is artificial intelligence, because artificial intelligence is a science which is very difficult to define in simple terms. But what we can understand is that it can learn from a lot of data, that what are the best questions they can a computer program can ask based on your previous questions or based on your profile. So if we learn that everyone who is a 50-year-old, maybe their concern about the side effect is different than people who are 95-year-old. So if we learn that and we know that pattern, artificial intelligence can learn based on the age of that person and ask the relevant question to understand the barriers of that particular individual, and then provide tailored information based on that concern, rather than giving out handouts or YouTube channels or a lot of information. Because if our system can provide tailored information, that information, the whole package will be smaller than what we provide for everyone, the same package, because that will be relevant to that one person, and that will be smaller to process. Not only that, artificial intelligence would be able to provide information on the level of the person's understanding. For example, it can produce that information in a different language based on the person's language, or it can produce that information based on their reading level. Someone is on 10th grade reading level, someone is on 6th grade reading level, and someone is on 15th grade reading level. So based on that reading level, that information can be provided. Or if someone doesn't want to read, or they may not have the ability to read because of maybe they don't want to look at the screen, maybe they don't want to process that information reading, then that information can be provided by recordings or by other information. So now what we are trying to do is we are realizing that artificial intelligence is probably the answer to not only learn about those patterns, but also to deliver that services to future participants. So for that purpose, my research is a first step towards that direction. What I'm trying to do is recruiting people who have had the diagnosis of prostate cancer in the past, and learning from their, when they start to learn about the prostate cancer or PCA even before the diagnosis, and how did they maneuver their treatment choice, and what are the type of uncertainties they had faced, and how did they cope with it, how did they make the decisions. And once we learn that, I'm learning this through the interviews, because interviews provide me ample opportunity to listen to my participants. So typically my interviews are about 2 hours long, where I don't speak, and I let my participants speak and tell me the information, because I'm learning from their expertise. And once I learn from them, then my expertise is to analyze that information and put this in a scholarly manner, to interpret that in a scholarly manner, and then so that we can derive some conclusions from that. And then I go to the next participants. So each one participant at a time, we do the interview, because we learn from one participant and then we change our questions, because our questions are not like survey questions. They are not fixed. They are based on my participant, what they share with me, and where they emphasize on those some questions. And then the importance of the question changes as the knowledge starts to build up. So it's kind of an iterative process of collecting the data, analyzing that data, and through that collecting the data, when we analyze that data, we generate more questions, or we refine our questions, and then go back into the next participant, or sometimes we go back to the same participant, ask the questions differently. It's a very rigorous process of generating knowledge. The downside of this research methodology, which is qualitative research methodology, that I cannot journalize it for everyone. So because those are one person sharing their story, you cannot generalize with other people. But we learn that information in depth, and eventually my hope is that methodology works in such a way that you run out of new data. You ask so deep questions and get all the answers that eventually after 15, 20 people, there is no more new data. All the data is taken. And then we develop a theoretical framework, and probably the next step for the next study, because I don't have approval for that yet, but as I'm building the data, I'm realizing that maybe the next study is based on that in-depth understanding. We can build a survey. The beauty of the survey is that then that survey can be sent to hundreds of thousands of people, and that's not one-to-one interview, because we already done that one-to-one interview. Now, to confirm the findings of these interviews, we can ask a larger sample, the survey that may take 15, 20, 40 minutes for the participants, and gather that data. And then the third study would be to invite some artificial intelligence researchers and try to figure out how we have lots of information available already. It's not, information is not a problem. Actually, what we are finding, and which may be true for many of you, may recognize or appreciate that it's an overload of information that's a problem. We need to know that information, but at that time people are too emotional because of they're going through this diagnosis process, and processing that information is the biggest issue. What is relevant for you and what is not relevant for you, finding that out. And sometimes there is not enough information. Sometimes one person finds that for their situation they need to know more, and I find my participant all the time doing their own research, depending on their abilities and depending on their strengths. So eventually, when we have this particular research that I'm doing, trying to understand those uncertainties and challenges, then we can probably have a survey research, a larger research, to confirm those findings. And then third one is inviting artificial intelligence researchers into the team and building some kind of a platform. It could be web-based or app-based, that would help people to get the tailored guidance, that what information they need and how to, and a support and a help to make a right decision. So that's the direction we are going in. I'm so humble, and I'm learning from people who share their information. It's very difficult for being a man. I can understand that too, to talk about prostate cancer, because it has associated symptoms, and those symptoms sometimes it's very difficult for some men to talk. But I'm very thankful and grateful to my participants who openly share this with us. And one of the safeguard that we do is we absolutely take consideration the privacy of of my participants. So we have safeguard in place, and our ethics board is very much aware about that. So ethics board, in my study, we put extra effort to go through that to every single aspect of the research, that we just want to make sure that nobody feels unsafe, that if they share their information, that information will not be tied to their identity. It will be, so we take the identity away from that person's identity by their name and first name, last name, and even their doctor's name and their clinic name away, and just keep that data, and then use that data as a group data with other participants, not with one individual. And that safety and security when we keep, so the benefit of that is that people share their experiences openly. And also because many people, the time is money, so we just want to also help. We got some funding in our research, so we actually be able to pay $50 for the interview, but also most of my interviews are double interviews. The second interview that I do consecutively in the same meeting within that 2 hours is how I want to learn from my participants that how was the interview went, what was the method of collecting the data, the questions that I asked, were they good questions or not good questions, were they intimidating or not intimidating, and also how can we recruit more people, because usually this research is going for more than a year now, and I have only 12 people, and all 12 people are Caucasian, white Caucasians, and we don't have any people from other ethnicities. So we would love to recruit people from all ethnicities, whatever it is possible, so that we learn different people's the challenges are different. So for example, if someone is, I'm an immigrant to Canada, I understand from my perspective that I learned how to ride a bus in Canada after coming here, even though I had a master's degree before and I was a professional working. But when you come to Canada, I didn't know even how to ride a bus, because our buses had driver and conductor. You go and sit in the bus, and then conductor comes to you and asks you for money, and then you give you change and everything. But here you have to have a change, and you drop that money in there, and then you get a ticket. And I couldn't even read the ticket. What is the meaning of these times here? So these small little things, people, and maneuvering cancer care, particularly the treatment decision, is a highly complex task. It requires expertise in that environment. I could be, I'm from India, I can be expert in India in many things, but first time if I come here as an immigrant, I'm like a child. I'm looking around for information and then maneuvering this environment. And at the top of that, if you have to deal with such a complex process, mental process of making a decision about the treatment, that's not easy to handle. But unfortunately, with all of our efforts, we are not being able to recruit people from other ethnicities. So this is my approach. When you invited me, one of the excitement for me is that I can say about my study, and I can find some support to recruit more people for this study. I still have maybe 10 more people to go, and I don't know, because my research methodology is such that you don't know until you have all the data, and data starts to saturate, which means when I do another interview, no new data, and do another interview, no new data, that's a data saturation point. You never know how many more interviews I will need, but I'm just anticipating with my previous experiences working with this research methodology that I may need maybe 8 to 10 more people. And I would love to have people from all ethnicities sharing their experiences and challenges. Other thing is that this kind of a group, one of the things about the prostate cancer groups is that they're solid groups, and you guys are like really tight and connected. And that is in research a little bit it shows, but I would like to also learn that how this help and then can be documented scholarly in a way. So maybe in future I will come back and ask your help to share your experiences with me later on. So this is my research right now. It's in the first phase. There are 2 more phases to go, which looks like my lifetime work. But so I like to be connected with all of you and be part of you as a researcher. Researchers are basically kind of an interpreter, translator of your experiences into scholarly way. You are the expert. So I am going to give this mic to Mayor, and we can talk, discuss, and we can learn from each other.
Yes, thank you so much, Dr. Singh, for giving this presentation.